happy to be joined today on Primetime Local News by Flavia de la Fuente from the Kidney Foundation, Northern Alberta and the Territories, the Executive Director. Thank you so much for joining us today.
Thank you so much for having me. So proud to be here.
Well, we're going to talk about March being Kidney Health Month, and there is so much to talk about when it comes to the Kidney Foundation and the things you do. But let's start by talking about some of the things that are planned throughout this month.
So it has been a busy month thus far, and we still have some more time to go. It's a wonderful opportunity for individuals to kind of do a health check. What's interesting is we can, feel our heart beating. Every time you breathe, oh yeah, my lungs are working, but our kidneys not so much, and they're behind you, and you really don't think about them until something is off with them. But your kidneys are your master chemists. And so what we've been trying to do is raise awareness in general about them. And we can go into more about what they actually do a little bit later. So we have been going into schools and raising awareness there, doing presentations. We just had our kidney gala where we were really working on promoting kidney disease and the importance of organ and tissue donation. We've been in renal units as people come in and out, and just to be able to provide that support of what we're trying to do. And of course, doing interviews and radio and information to let the general public know 1 in 10 Canadians is impacted by kidney disease. And here in Alberta, that's over 600,000 Albertans living with chronic kidney disease and impacted in some way.
Well, and that leads me to my next question regarding organ donation. There are a lot of people who are waiting for kidney transplants. And it seems to me when I've talked to people involved with organ donation on the national level, that we're not so great for signing the organ donor cards and getting, on the list and making sure that our relatives know our wishes. So is that something that you guys struggle with too, is to try and create that awareness of the need for the kidney transplants and organ donation?
Absolutely. It's critical. There's many treatments that can, impact those facing kidney failure. And the one that always seems to be the go-to, which in our opinion should be the last option, is in-center dialysis. That means going into a hospital. And obviously there is the time that is needed for all of the opportunities to go into the various modalities in-center, as I mentioned, hospital. Home hemodialysis is being able to take the dialysis machine into your home. It allows flexibility, but again, it is still, you're having to regulate 4 hours, or some do nocturnal dialysis overnight. Peritoneal dialysis, same thing, it allows you that flexibility, but again, just certain things are restrictive. Whereas in organ donation, it is the best treatment. Kidney disease is chronic, but if you wanted the best possible treatment, the gold standard would be a living preemptive organ transplant. And it helps an individual to lead a full life and as best as they can. Sadly, in Alberta, we are a bit of a laggard in organ and tissue donation. 90% of Canadians believe in the importance of organ and tissue donation, and yet our system needs to be able to catch up and have that, which is why we, as the Kidney Foundation, advocate that so much. Here in Alberta, I recommend that your viewers and everyone listening can be able to go into moretransplants.ca, where we have put in exactly what we've been advocating for to the government, and helping improve as well for healthcare professionals, to the system to be able to change. We know it is supply and demand. Currently, the demand is huge and the supply is very limited, but everyone can make that difference. So we say, live your life to the fullest and then pass it on. That's the beautiful part about organ donation. And don't discount yourself because, I'm older, I don't think so, or I have this other illness. Let the healthcare professionals decide that. On April 1st, Bill 205 will become enacted, which is the Human and Tissue Organ Donation Mandatory Referral Act. Exciting. That helps us to be able to show best practices, and that is happening here, in Alberta. And what is needed is for individuals to have those conversations with your family. We believe that organ and tissue donation should be discussed every day. It should be part of the norm. And then those wishes should be respected at the time. So then again, obviously during those critical moments that is very hard for a family dealing with certain, life and death choices, and yet for the individual to have already had those conversations and to be able to pass it forward, as we saw what happened with Logan Boulet, who started the Boulet effect. They had those. It's so critical for everyone to be able to make that part of the discussions at all ages, and then for the system to be able to operate and maximize that, because organ and tissue donation not only saves money, but more importantly, it saves lives.
What kind of assistance can you offer for people who are dealing with kidney issues? How do they reach out to you, and what are some of the things you can offer to them?
Absolutely. We have so many amazing programs. One of them is our short term financial assistance program, STF for short. And that is how we explain it. Our healthcare system helps with the treatment, we help with an individual's life. And so, with this program, it is putting food on the table with grocery cards, gas cards, bus tickets, bus passes, taxi, accommodation, medication assistance. You can't get a transplant unless your teeth are healthy. We help cover dental coverage. There is those that are having to travel 40 kilometers or more for coming into various treatment. If you don't have a space available in your area, we help also on that part reimburse to help with through the gas card program. That's our dialysis transportation program. For those that are doing home hemodialysis, again, choosing to take the dialysis machine in their home, we help to reimburse their added electricity and water costs to be able to have that option more affordable. For living donors, and this is not just for kidney, we do it for liver and for lung for the entire province of Alberta. We help break the financial barrier. And so our living donor expense reimbursement program, which should just be called the superhero program, because that's what these individuals are doing, from covering their travel, accommodation, loss of wages, parking, meals. I mean, the list goes on. What it allows, anyone can come from anywhere in the world. As long as they save the life of an Albertan, our program kicks in to be able to break down that financial barrier. And then in general, providing our peer support through our Kidney 101 program, our various educational binders, brochures, our presentations. The list really does go on, and we're always getting stretched, right? We're always pushing the envelope because we have to advocate for extra support. We have to raise the awareness of how important this is. And then, of course, through our events, like I said, our kidney gala, but we have Kidney Walk coming up in the spring. And so that's how public and donors can be able to help us with all of our amazing programs that really impact the kidney and the transplant community that we serve.
Well, Flavia, it has been a pleasure to speak with you today. Thank you so much for joining us. I really appreciate it. And you guys are doing amazing work. So keep it up. Thank you so much for chatting with us.
Thank you very much. And as I always say, we're behind you all the way. And if anyone ever needs us, we are here for you. Thank you.